Over the past several years, we've been engaged here in Washington and across the country in a conversation about our nation's deficit and debt and the cost of federal programs. The conversation has been serious and at times heated. Unfortunately, we've yet to reach a consensus on a plan to extract the country from the serious financial challenges that we face. But there's one thing, however, that I think we can all agree upon, and that is we must stop the fiscal bleeding caused by waste, by fraud, by abuse. This is a small subcommittee, but for years we've been almost singularly focused on how the federal government can get better results for less money or better results for the same amount of money, whether the chairman is Tom Carper or Tom Coburn. That has been our singular focus and continues to be. Working together with partners such as the GAO, OMB, Inspectors General, and other government watchdog groups, we've tried to maximize our oversight, and I believe that we've begun to make a real impact. We've drilled down on how the federal government wastes millions annually maintaining properties and buildings we neither want nor need. We've examined the billions that agencies waste on $125 billion and avoidable improper payments made to contractors, to ineligible programs, to participants, and even to dead people. We focus like a laser on federal information technology projects that have gone billions of dollars over budget without ever delivering any real benefit. One issue we spent a lot of time taking a look at recently is the enormous amount of fraud and waste and abuse that are perpetrated within Medicare and Medicaid. These programs provide life-saving benefits, as we know, to millions of our nation's most vulnerable citizens. Unfortunately, too often criminals have figured out how to use Medicare and Medicaid for their own gain. Roughly 2 years ago, we held a hearing dealing with fraud and abuse in the Medicaid program in this room. At that hearing, we learned that GAO had found tens of thousands of Medicaid beneficiaries and providers involved in fraudulent or abusive purchases of controlled substances through the program. After that hearing, we asked the Government Accountability Office to see whether or not something similar might be going with the Medicare Part D prescription program. I was disappointed, but not surprised, to learn that GAO has found evidence that a number of Part D beneficiaries are likely abusing the system to obtain powerful drugs, to fuel their own addictions, or to sell them on the street. As part of their analysis, GAO auditors looked at all of the prescriptions paid for by Part D in 2008. Combing through over 1 billion prescription records, they found that over 170,000 Part D beneficiaries apparently engaged that year in a practice commonly known as doctor shopping. These beneficiaries have gone to 5 or more doctors to obtain prescriptions for the same drug. In one case, GAO found a beneficiary who received prescriptions from 87 different medical practitioners in that one year, 2008. In another case, the beneficiary received 3 years' worth of oxycodone. Is that right? Oxycodone. All right. Oxycodone pills from 58 different prescribing doctors in just 1 year. We need to be honest about what these findings mean. They mean that federal dollars intend to address the health needs of the elderly and the poor are instead being used to feed addictions or to pad the wallets of drug dealers. This is clearly unacceptable. According to GAO, the control that CMS has put into place to stop this sort of abuse haven't done the trick. Under the plan CMS has put in place to combat doctor shopping, if a Part D plan sponsor suspects a beneficiary is doctor shopping, they send a letter to the doctors who've been visited. The letter is sent along with a self-addressed envelope in which the doctors can send a response to the sponsor's concerns. In some cases, the doctors will stop giving the doctor shopping patients prescriptions. In other cases, they won't. Sometimes the letters go unanswered. GAO has made several recommendations to CMS on how to tighten up controls of the program. Included among these recommendations is a suggestion that beneficiaries be limited to one doctor and one pharmacy, an approach that many states use in their Medicaid programs. I look forward to hearing more about this suggestion from our witnesses today. In addition, I understand that just last week, perhaps as a result of GAO's work, CMS has issued new guidance to Part D plan sponsors. This guidance suggests that plans begin denying beneficiaries at the point of sale if they suspect abuse. This is an important change, and again, I want to hear more about that today as well. I've worked with Senator Tom Coburn, with Senator Brown, and others on this panel to work on bipartisan legislation that curbs waste and fraud in both Medicaid and in Medicare. Our legislation S-1251-1251 contains a set of important steps that will help rein in those trying to defraud our federal health care programs. Our legislation has provisions that directly affect fraud in Medicare Part D, including strengthening the prescription drug monitoring programs and requiring closer coordination between CMS, their oversight contractors, the DEA, Drug Enforcement Agency, and state and local law enforcement. Our proposal also requires that the list of doctors who can prescribe controlled substances like painkillers be maintained up to date and accurate. As many of you know, 12 of our colleagues are currently serving on a bipartisan, bicameral joint committee that has been tasked with, by the rest of us with coming up with a plan to begin to put our fiscal house in order. If at some point that committee and Congress as a whole are to come to agreement on a meaningful plan for addressing our country's fiscal challenges, we'll need to address issues like the ones we're talking about here today. As I close this opening statement, I want to comment on prescription drug abuse. The dangers associated with the misuse of prescription drug have become known in the past few years as celebrities and other public figures have succumbed to their lethal effects. However, less widely publicized are the millions of Americans, including children, who abuse the same drugs. Unfortunately, children are abusing prescription drugs at an alarming rate. One out of seven teenagers reportedly has abused or is abusing prescription drugs today. This is a drug problem that could impact any American home with a medicine cabinet. As a father, I find this news especially troubling. And I want to make this point so that it's clear. While there is a financial cost to the fraud and abuse of controlled substances paid for by Medicare, and we're mindful of that, we cannot ignore the fact that there's a human cost as well. Prescription drug abuse is the fastest growing addiction in the United States. The difference between a street drug like cocaine and a prescription painkiller is that in many cases, as this hearing and this subcommittee's previous works show, the federal government is often paying to feed this addiction with taxpayer money. Aside from our financial imperative, then, we have a moral imperative to ensure that our public health care system isn't used or misused to further intensify and subsidize a public health crisis. And I don't have the full list. Before I turn it over to Senator Brown, I don't have a full list of the illegal drugs whose cost, if you add up, or their street sales, if you add it up, actually are still less than the value of the prescription drugs, the controlled substances that are being shopped and sold. But it includes cocaine. What else? Cocaine, heroin. Any others? Yeah, there are others. Cocaine, heroin, and others combined. So think about it. When we think about how big is this problem, add up heroin, cocaine sales, and a number of other illegal drugs, and add them all up, and the total is less than is involved in the sale of these controlled substances. It's a big problem. It's a problem that we're beginning to address. We're going to learn a lot more today about how we can further address it.